So I'm Stephanie Hornsby, an occupational therapy student.
And I'm Andrea Willipede. I'm also an occupational therapy student. And yeah, we are both fourth year and currently studying at Occupational.
So what is OT? That is a question everyone asks us when we tell them what we study. So basically we tend to use our knowledge and skills that we've learned over the 4 years of studying and apply them in different situations to actually help people participate in activities of daily living. So that's activities from personal care, so washing yourself, just sleeping, working, kids playing, doing leisure time activities. So we find ways that we can maybe adapt that, if we can help them find better ways to do things. We adapt a lot. We make the world work for them. So even in strokes, we do rehab with them. Various other things.
The main goal of occupational therapy is to take what that patient needs to do, wants to do, and the roles that they have to fulfill, and help them do that. Yeah. And if they can't do that, you have to either adapt the environment or adapt the occupation. The next question.
Ukwanda. Ukwanda, so for OT, we're here for 4 blocks at a time, 4 clinical blocks. They are 6 weeks at a time. We were placed at a school to work with learners with perceptual difficulty or learning difficulty. We work at Worcester Hospital. We work with stroke victims, amputations, TB, traumatic brain injuries,
spinal cord injuries.
We work at Tuflig, that is a substance dependent and alcoholic dependent rehab center, and then we do a community interaction block where we work within the community with various projects.
The experience. How have you experienced Ukwanda? I think it's been great so far.
Yeah,
I really enjoy getting away from the city life and being here in the same place for so long. It's really nice, and the people are very kind.
It's been a home away from home, even though we've been here for 4 months. It's been amazing.
Yeah. Why did you decide you wanted to become an occupational therapist? Why did you decide you want to become an occupational therapist, Steph?
So from a personal point of view, my mom was a very sickly person. She had people care for her all the time. I had to care for her. She was in and out of hospital. So I didn't want someone else to have to go through that without experiencing some sort of love, some sort of care, because I watched my mom not be cared for in a loving way. And if I can do that for a handful of people, I mean, my life was fulfilled. Like, I've served some sort of purpose. So mine was to definitely be in a career that's involved in rehab, so getting people back to what they used to be or close to what they used to be, or finding fulfillment in life despite their diagnosis. So that was my reason.
And I always knew I wanted to work in some sort of health science direction, specifically because I would really like doing something that helps people on the daily. But I could never be a doctor. I don't have the stomach for it. I shadowed a few of the other disciplines and really fell in love with OT. I just love the broadness of it, the fact that it doesn't have a routine, the fact that it doesn't really have a recipe. You kind of have to be creative, and it really focuses a lot on relationships, and that's what I love.
So for OT, we deal with basically every type of diagnosis. We don't focus on just children. We're not play teachers, as everyone thinks. We work with every type of human. So if you think of children, for an example that I can give, a health condition that occurs a lot with children is depression. And most of the time depression occurs not just because of the actual depression that they've been diagnosed with, but multiple other facets. So if they've had a different diagnosis, if they've maybe been diagnosed with CP, cerebral palsy, or they've had an amputation, or they've been in an accident, or they're in hospital for a long time, depression comes in with almost every diagnosis. So we handle depression in various ways. We like to handle it for kids in group sessions, where we do lots of different creative activities with them. We do lots of leisure time activities with them. We do cognitive behavioral therapy with the older children so they can understand how their behavior is affected by their thoughts and their feelings.
As well as with depression, you kind of treat the family as well, because it's very hard on the family, so you do some psychoeducation groups with the family on how they should deal with depression, and yeah, it's not just within the patient itself.
Yeah.
Another pathology we really treat a lot is cerebral palsy in children. With cerebral palsy, we usually use, this is going to sound very technical, but we usually use neurodevelopmental techniques to influence their, I don't know how in detail I should go, but to influence their bodily tone and to stretch out spastic limbs, and then we encourage them to participate in activities after we've done all that preparation techniques. And with cerebral palsy, we also work a lot with the family to teach them how to handle the patient, and to how to correctly position, because those are really important things when it comes to cerebral palsy.
Yeah. So what are the challenges of an occupational therapist? In every facet that we work in, I think resources is such a big thing. But the lucky thing with OT is that our main job is to adapt. So we adapt very easily, we become very creative, make things out of paper and cardboard. That's the biggest thing, I think. And then just family cooperation is also a challenge in OT. Having families follow through with treatment, because treatment doesn't just happen in our clinic or just at home visits or at the hospital. Treatment happens for the rest of your life, and you need a support system. So training family members and their willingness to be trained is also a really big challenge for us.
As well as just from an occupational therapy student side, I think our course is it's a very hard course. We have a very heavy workload, but it is very rewarding in the end. And also specifically, I want to talk about the emotional burden that comes with what we do. We see a lot of upsetting things, and how to deal with that. It can become a real challenge.
The most rewarding thing about OT. We can go on for days about this one. Every little thing is rewarding.
Seeing the tiniest little step of progress.
Seeing a smile when there was never a smile. Having that thank you for what you do.
Seeing their appreciation for what you do, and seeing a patient really being thankful for what you do to them. It's great. It's a very rewarding occupation.
Advice for school-going children? Personally, if you want to study OT, or if you've been to an OT, if you've heard about OT, that is amazing. But my advice would be to go job shadow, to go volunteer, to expose yourself to every bit of OT, because you need to be mentally, physically and emotionally prepared for what you're going to be exposed to. We see so many things, and things do take a toll on us, and we have to get sometimes help for ourselves for just handling those sort of things. So job shadowing, just volunteering in general at a hospice, at a hospital, any centre, schools with learning disabilities, things like that. And just expose yourself.
And make sure that you do have, that you really want to do it and have the passion for it, because it's a hard course for us who do have the passion. So if you don't have that passion and drive to do it, I would not recommend studying the schools.
And you have to love people. If you don't love people, there's no point in doing what we do. We have such a heart for people. And that's almost the center of our degree.
And you kind of have to have a heart for the underdog, because we always root for the underdogs.
What are our goals or dreams
in terms of occupational therapy? What is your plan ahead, Steph?
My plan ahead. So my plan ahead is to work in neurology, to work with spinal cord injury patients, brain injuries, stroke victims, things like that. Further than that, my goal is to one day become a manager of a hospital, be in the forefront of how things work. It's going to be a lot of policies and rules, but because of what I've personally gone through with my mom, I've got to be at the top to have the best for people, you know.
I can so see you doing that.
So yeah, that's my goal, manage a hospital one day.
My dream for OT is to go study overseas or just do my master's and bring back some of the technology and some of the treatment modalities that exist beyond the borders of South Africa. I really want to become a pediatric OT. I love kids and I have a passion for working with them. Yeah, that's my dream.
Thanks.
Yeah, thank you so much.